coming, and it's very low. You don't need to have it cranked up. A nice thin tip with a low number. This is the, what do you call it, the discus tip. This was the Protege before. Who used this one? It was kind of cool. It was really novel and supposed to swivel. It really didn't swivel very good, so they redid it, and they have a really cool one now. The light is all the way around. It's a much stronger light, and I'm telling you, it just twirls in your hand like butter. It's awesome. Atridox was on hiatus mostly because it kept on being bought and sold. It's that kind of an arrangement. This is probably the least expensive, and you can do a number of pockets at once. This is the Arestin, which is easy because it's not as messy. Don't forget lasers. Are hygienists allowed to use lasers? We're not in Wisconsin either. So this is what I do to the board. That's my laser. So, and here's xylitol. We don't have all the research or even enough research right now, but you can see the tissue response here in this patient that was on xylitol gum for two weeks in this pedo office. That was the only thing. Oh, brush better. That was oral hygiene instructions. The DNA testing, this is kind of an old slide. It's very simple to do, and it gives us enough information so that we can choose what kind of antibiotic to use. This here, as being a disadvantage, I really don't think is a disadvantage. Any time lapse between just doesn't matter when we're talking about this kind of thing. But it's not an acute kind of an infection. So they have a DNA test that you can test the bacteria in the pocket, and they also have a DNA test that will test the patient for susceptibility to the periodontal infection. And to me, that gives you some information when you're doing a restorative case. So we're almost out of tape.
Give me time out.
All your bits and pieces. So this is what the other one looks like. Surface area, we already talked about. 100,000 times more bacteria in periodontal disease than in health in that part. The temperature increases. What if we had a periodontal probe that measured the temperature? Wouldn't that give us more information than the pocket? I mean, really, there's just so much more that we can be doing. Initial plaque formation, we talked at length about. I would encourage you to never ever use this term again except on your insurance billing forms. Who can scale and root plane a 4 millimeter pocket? Nobody, right? You can't do it. The dentist will hire a consultant. The consultant comes in and says, you have to use root scaling. All these, and you're like, there's no effing root there. Try it. Go ahead. Try it. I dare you. But what you're really doing is periodontal therapy. And you have to change the name because calling it scaling and root planing screws everybody up. Because it needs to have some kind of therapy, but it's not full of calculus. It's not a calculus disease. It's a biofilm disease. So try to, just even amongst yourselves, just call it periodontal therapy. The ecology here is different. We already talked about that. Here's another little thing here. Well, you know what? You can find this on YouTube too. Tom Neighbors also said this at the World Congress of Minimally Invasive Dentistry. Is anybody else shocked by this? I've been saying this for years, and I could only say it in private conversations with people because everybody was like, it is not. You cannot cure it. It is always there. It must only be managed. Once you get the infection controlled, it's cured, just like the strep throat, just like anything else can be cured. Periodontal disease can be cured, and it's not just me saying it anymore. A person with a terminal degree says it. So, I would encourage you all to join the AMI-RDH group because you can't do this all by yourself. You need to have information from everybody. Get yourself something to take care of yourself in your social world and in your physical world. Get yourself some loops. Get yourself a chair. If you're in pain all the time, you can't practice at this level. because you're going to be distracted. I have a book, in case you didn't know, it's called The Purple Guide. It's for new and newly graduated dental hygienists. I've got all the codes you need in there, how to use them, what questions to ask at an interview, how to ask for a raise, what you need to have in order to get a raise. I did not bring any books with me today. I'm sorry about that. And it also has in there, in case you didn't know, how to become a prima donna. So sorry. So we've got that movie. We've got Career Fusion, in case you are of a mind where you'd like to do something a little bit more with your career. If you'd like to start writing, or maybe you want to do lunch and learns for a company, or just something like that. CareerFusion.net is our website. And I'd like to just kind of close by reminding you all that we have a lot of holes in dentistry. Am I right? We have the hole between the lips, right? We have the hole in the tooth. We got to get rid of that. Got to fix that. There's a hole down along the side of the tooth. We have to fix that. Oh my God, if that's there. If you take a tooth out, we have the hole in the arch. We have to fix that. We have to wait for the hole to fill in the bone. Then we fill in the hole in the arch with a bridge or with something else like that. Oh my God, there's a hole in the schedule. We got to fix it. But really what we're talking about is the whole patient. That's what we learned in school. We learned that the entire body is connected, and we have to talk about the whole patient, the big W. That's the most important part of this whole discussion, with any discussion that you're ever going to have. Thank you so much. Thank you, Doctor, for having me here, and Richard for having me here, and all you guys for having me. Crack jokes. And Richard has the GoPro there, so you can take a look at that. He also has the C-reactive protein test, so you can get a good look at that. So,
please take a look at the stuff Richard has back here. I mean, some of it, pretty cutting edge. You guys kind of used to it. Some of these things, as a paradigm community, we've been promoting for decades, and slowly stuff becomes involved and gets to the medical field, to get into whatever field, to get through the patient's mind. But as we slowly progress, we slowly get to where our goal is. So this is what he's got. I use the GoPro in my office on a daily basis. We don't have the GoPro, although I'm looking at it. Talk to Richard and Ian about it. I'm looking at it because I think it's very useful for the practice. It helps everybody out, saves time, etc. But the blood test, I'm also looking at going to my office for diabetics especially. But the C-reactive protein, I'm excited about because you can take a test, I think, $25 for the C-reactive protein test.
You don't hear, they usually can hear me anyway. No, wait,
Would you like that?
yes?
Yes?
Yes. I love Kristen, she's great. So the C-reactive protein test is something I've been looking at going to because, think about it, it's $25 what he was telling me to do that. So if you do that, $20 can be added into your scale and root plane fee, or $5 a fee, $5 a quadrant or whatever, and nobody's going to notice it. You can do that, show them before and after results, and you can have something to show them. Because a lot of times, they might see bleeding reduction, but how many people really appreciate what it is you do every day? They don't appreciate most of the stuff that we care about. So I like that a lot. Also, as she was saying, helps diagnose underlying conditions that may be going undiagnosed for decades and really cause somebody death or something else. So I like all that. So please talk to those guys. Beeline does a really good job providing us with a lot of supplies. So they did sponsor tonight and bring in, our lovely speaker. So please support them and feel free to ask her or myself or any of you guys at Beeline any questions you have. Thank you much for coming. I'll see y'all. When's the date, Keisha? July 14th.
If I don't have your email address, just write it. No, okay.
Give Keisha your email address, please. Thank you very much, ladies.